When it came to, I guess, CCATs, I always kind of go back to when I was a student. And I remember I had some great courses and I really loved them. And then I also had some not so great courses. So for me, it was, what can I do to make my course enjoyable for my students? And so for me, the three main things is firstly, engagement. I think the way we teach has changed a lot over time. I went through that very didactic, passive teaching where you just sit in the classroom. But for me, it's really getting the students involved in the learning activities that we do, as opposed to just receiving that information. Secondly, for me as well, especially being in a health professional course, it's creating a safe environment. Especially as health professionals, we have a lot of pressure to be able to do everything correct the first time. And so we're very fortunate that we can practice in a simulation lab on, fake patients, that we would call it, so that we can make those errors and mistakes and really refine our hand skills so that when students go into the clinic, that they actually feel comfortable. So I guess having that safe environment where, they can learn from those mistakes, I think is really important for them. But then also lastly as well, it's understanding. I feel like now as students, it's not just being a teacher, but it's looking for someone who's a mentor. And so I think for students, they actually really appreciate when someone has that empathy towards them and actually understands, being a dental student is hard work. It's not an easy journey. It's a long 5-year journey. And so by giving my little anecdotes and my times as a student to them, it really does encourage them just to push forward. It's interesting because when I was a student and I used to fill out those surveys or CCATs every year, I really didn't think that they made any difference. And so now being on the other side as an academic, it's made me realize that it actually does make a lot of difference. And so for me, it does actually change how I structure my course semester by semester. Based on that feedback, I've been able to keep things that students have enjoyed, but at the same time, if there was something that didn't really work out, I've managed to take it out and change the approach. So for me, it makes a lot of difference, and I try and emphasize that to the students, and they do appreciate that I do actually take it in and try and adapt it to what would help suit their learning style. For me, I try and check in with the students quite regularly. I'm in a unique position where I just don't coordinate a subject, but I'm also a year coordinator. So I feel whenever I'm with them, whether it's a learning activity or in the clinic environment, I do try and have open, direct conversations with them. How's everything going? How are all your other subjects going? What's working for you? What's not working for you? And so I find just by doing those regular check-ins, it just makes it feel more personal and not just these kind of standard blackboard announcements that, where it just seems too generic. Yeah. It's not so much not so great results, but I do enjoy reading all the individual comments. And so what I even find is maybe, everyone was quite happy with one aspect, but you'll find one or two students where they made maybe a negative comment. But for me, that also helps me understand the diverse learners that we have, because obviously one mode of teaching might not necessarily suit everyone. So by trying to implement other alternatives, it's actually helped me kind of cater to those other learners where something might have not necessarily suited them beforehand. And a lot of people ask me this because they're going, how do you get so many of them to respond? And it's my little side joke is haggle, but it's really sitting down with them. So what I do is at the end of each semester, I run a little kind of information session where we go through, how to prepare for your exams. And then I also touch on the CCAT. So I allocate some time where I kind of give them my little spiel about what CCATs mean to me as a coordinator and how that can help them for the next semester and obviously the next cohort coming through. And so by allocating that time and just letting them sit down and actually fill it out on their laptops, I feel like is what has helped get that response rate. I find if it's not really emphasized and you kind of just leave it on the side, it's like with any email that we get, anytime I see a survey, the first thing I think is, oh, no thanks, delete. So I think just spending that time with them really reinforces that for them.